Hi, and welcome to this presentation. My name is Kathleen Camp, and I'm a peer educator for the American Bone Health Organization. As a physical therapist, this topic of protecting your bones is very near and dear to my heart. This presentation was created by representatives and experts contributing to the American Bone Health education. American Bone Health will now be partnering with the Bone Health and Osteoporosis Foundation to continue to provide educational tools and resources. So the resource that we'll be talking about today is the fracture risk calculator. So let's cover how to calculate your personal fracture risk and use that calculation to make treatment, lifestyle decisions, including next steps, and guide you in being proactive to learn about your risk of before you have a fracture. And so the American Bone Health has developed this online tool that will help you calculate your future fracture risk. So here are the factors that determine your fracture risk calculation. They include not only bone density, but also bone quality, age, race, and gender, body mass index, medical conditions and medicines, lifestyle, fracture history, both yours and your parents. So this tool, the American Bone Health Fracture Risk Calculator, uses data from large research studies that quantify the impact of each of the risk factors and is available on the American Bone Health website and will soon be moved to the Bone Health and Osteoporosis Foundation website as well. The fracture risk calculator estimates the 10-year fracture risk for postmenopausal women and men aged 45 and older who are not receiving treatment for osteoporosis. This is a valuable tool for use in discussions between patients and their healthcare provider about the prevention and treatment of osteoporosis. The tool has a patient-friendly graphic display of the risk results, comparing it to expected risk, and categorizes the risk as low in green, medium in yellow, or high in red. So I will now show you how to fill it out, what the results mean to you individually, and what steps you can take to reduce your category of risk. So to access the calculator, please go to the link that you see listed on the screen. We'll go over the questions that are on the calculator together now, but you can follow along either on your smartphone or in another window of your computer. Some of your fracture risk is determined by your age, gender, body mass index, also called BMI for short, and race or ethnicity. Personal factors are things you cannot control, such as your age, gender, and genetics, as well as your race. But with age, we know the fracture risk increases. Gender, the fracture risk increases for women, especially after menopause, because of the loss of estrogen. And gender refers to gender at birth. And then race. Your fracture risk is higher for whites and Asians, but can really affect all races. Height and weight. Neither were really significant risk factors, but are included in order to compute body mass index. Fracture risk increases if you have lower BMI or body mass index. Although you have some control over your weight, you don't have control over your height. Your bone density is also part of the risk equation, but not all of it. It is not necessary to have your T-score from a bone density test. The calculator will still calculate your general fracture risk, which is the general risk of someone like you, the same age, height, and weight. The more information we provide to the calculator, the more accurate the assessment. You can always rerun the calculator with your T-score. If you do have your DEXA score, it would be ideal if it were no longer than about 2 years ago. If you've had a DEXA and there is a minus sign, be sure to include the minus sign. And the femoral neck is the hip, not the neck that holds up the head. Now, questions 9 and 10 look at some lifestyle factors that affect your fracture risk, but can be changed. The two big ones are smoking and vaping and excessive alcohol consumption. Now, with smoking and vaping, there is a direct relationship between tobacco and decreased bone density, whether it's the smoking or the other risk factors of smokers. Cigarette smoke produces excessive amounts of two proteins that trigger a natural body process that breaks down bone. Also, smokers are generally thinner than non-smokers, drink more alcohol, and are less physically active, have a poorer diet, and go through menopause earlier. In addition to the increased risk of fracture, the fractures that do occur are harder to heal. New research shows that secondhand smoke can impact the development of peak bone density in children. And with alcohol, we see that excess alcohol has a negative effect on bone density, fracture, and fracture healing. When you drink too much, the stomach does not absorb calcium adequately. Alcohol also affects the liver and pancreas, which are important to activate vitamin D and calcium absorption. And alcohol decreases estrogen, and as it declines, bone remodeling slows and leads to bone loss. Cortisol and parathyroid levels are increased in alcoholics, leading to calcium malabsorption. And excessive alcohol consumption can not only impact the quality of bone, but can increase the risk of falls that can lead to fractures. Excess alcohol is defined as more than 7 drinks per week for women and more than 14 per week for men. One drink is defined as 5 ounces of wine, 12 ounces of beer, and 1.5 ounces of hard liquor. Binge drinking is consuming 4 or more drinks in 2 hours for women and 5 or more for men. Now, the combination of smoking and alcohol can cause nerve damage called peripheral neuropathy that can also lead to falls. So, several chronic conditions can not only cause bone loss, but may increase your risk of a fracture caused by a fall. Sometimes the medicines used to treat chronic conditions can also accelerate bone loss or increase fall risk. Oral or inhaled steroids are prescribed for several medical conditions. Inflammatory diseases needing prednisone or steroid oral medicines of more than 5 milligrams per day cause rapid bone loss by affecting the bone remodeling process. Other diseases needing inhaled steroids may become a concern for bone health if taken for extended periods of time, such as at 400 micrograms per day for some inhaled steroids and greater than 200 micrograms per day for others. So please see the steroid names listed on the slide. We're not concerned with short-term usage such as 2 weeks of prednisone for poison ivy, but long-term use for treating chronic conditions can create a problem with bone health. Rheumatoid arthritis, or RA for short, carries both the risk for osteoporosis and the risk of fracture. RA's inflammation around the joints contributes to bone damage, possibly by stimulating bone cells that deplete bone minerals. Pain leads to reduced activity, and prednisone, a corticosteroid drug used for decades to control inflammation, is one of the notorious culprits in bone mineral density loss. Now, diabetes can also create bone health issues. Low insulin levels in childhood or adolescence may lead to weaker bones and an increased risk of fractures in adulthood. Excess blood sugar affects collagen in the bones, making them brittle and more likely to break. And diabetes medicines also increase fracture risk. People living with diabetes are also at an increased risk of falling and fracturing because of blood sugar levels, declining vision, associated peripheral neuropathy, and nerve damage. So when you have a serious chronic medical condition, often the treatment or the lack of it causes bone density loss or bone quality change, either of which can result in fractures. The prevalence of multiple chronic conditions significantly increases with age. In 2010, 26% of U.S. adults had multiple chronic conditions. 68.4% of Medicare beneficiaries had two or more chronic conditions, and 36.4% had four or more chronic conditions. So, question 14 looks at the added risk of these chronic medical conditions. Cancer and its treatments, such as radiation, chemotherapy, surgical treatments requiring removal of the prostate, ovaries, or parts of the colon or stomach, cause hormone deficiencies, low calcium and vitamin D levels. Cancer can also metastasize to the bones. Untreated hormone deficiencies, these can include the sex hormones estrogen and testosterone, including those hormone deficiencies caused by breast or prostate cancer, deficiencies as well in the parathyroid hormone or parathyroid or PTH for short, related to parathyroid disease and hyperparathyroidism. Long-standing malnutrition or malabsorption diseases, including lactose intolerance, celiac, or Crohn's disease. People living with disordered eating conditions can experience issues with calcium absorption, as well as other nutrient absorption issues. People who've had weight loss surgery create a surgically induced malabsorption condition. And high doses of a thyroid medicine, taking more than 250 micrograms per day for many years, increases the activity of the osteoclasts, the bones that break down or the cells that break down bone, and put you at an increased risk for fracture. Chronic liver diseases are associated with bone loss due to decreased bone formation or increased bone resorption. An organ transplant, the use of immunosuppressant drugs for life, increase fracture risk. And finally, fracture history, yours and your parents. Family history and genetics are important factors that determine your risk of fractures. About 65% of your bone density is a result of genetics. Family history of broken bones means that you're at a higher risk. So if your mother or your father had a hip fracture, you are at increased risk. And then personal history. If you break any bone except fingers or toes from a trip or fall on the level ground after age 45, you're twice as likely to break another bone. If you have a spine fracture, you're 4 times as likely to have another spine fracture. Your own fracture history can contribute to your fracture risk. We fracture for a reason. Sometimes that reason is related to the quality of the underlying bones. Any fall from a standing height or less that results in a fracture may be a warning sign of osteoporosis. Fracture can be a sign of underlying fragility, called a fragility fracture, which can indicate osteoporosis. Our bodies should be able to sustain a fall from a standing height without a fracture, unless there is an underlying cause that makes the bones fragile. A fragility fracture is sometimes defined as a fracture from something you wouldn't expect to cause a fracture. A fracture also changes the alignment of your body, putting you sort of out of kilter and making a subsequent fracture more likely. Any fracture, including toes, can and often does lead to changes in alignment, balance, and muscle strength during healing. Any of the 4 osteoporotic fractures at the hip, shoulder, wrist, and spine can lead to alignment, strength, flexibility, and balance problems, which can then cause a secondary fall in the future. And new research in 2018 shows that any fracture will trigger inflammation throughout the body and cause systemic bone loss. So breaking a bone causes bone density losses throughout the body, not just close to the site of the fracture. So have you been told that you have a spine fracture? Either a doctor diagnosed you or it was reported on an X-ray? So the purpose is to identify other factors that may affect bones and lead to fracture. There are other factors that affect bone health and can lead to fractures which are not directly figured into the fracture risk calculator, but it's important to be aware of these other factors. They include loss of muscle strength or muscle mass, especially when coupled with poor balance. These can increase fall risk, leading to fractures. When your body is in a state of chronic stress, such as with elevated cortisol levels, bone formation is disrupted, and cortisol indirectly acts on bone by blocking calcium absorption, which decreases bone cell growth. Calcium is crucial for heart and muscle function. If the body does not get adequate calcium from the diet or supplements, it will scavenge it from the bones. Vitamin D is required to help the body make use of calcium. So if vitamin D levels are too low, the body may not absorb calcium properly. And increased salt and caffeine in the diet can cause the body to excrete calcium and lead to bone and muscle mass loss. So the last question before finishing the calculator will cover general information we like to know, such as your zip code, so that American Bone Health can reach you with education and possible programs. They would also like to stay in touch with you to provide additional bone health information. So they ask you for you to provide a valid email and name. You can also provide your full address and phone number if you like. But when done with the short form, you simply click the Calculate Risk button. A graph will then appear showing your 10-year risk of any fracture. You will also receive in your email a PDF report with your results, and you can immediately download the results by clicking the button, Download your PDF report. So to help you learn what steps you should take to maintain and build strong bones for life, American Bone Health will send a series of emails, 6 in total, outlining more information about creating a personalized bone health plan. Please be sure to opt in to receive this important information. So we've just run through how to take the calculator. So now how do you make sense of it all? So based on your answers to the fracture risk calculator questions, the calculator uses previous research and a large database to create an individual risk assessment. So this is a sample of what the graph will look like, either in your email or on your smart device. The dotted line is the general risk of someone like you, the same race and gender, over time. And you'll notice that your general risk goes up as you age. So you'd want to take this report with you to your healthcare provider appointment. It's also downloadable again as a PDF, so you can email it to your healthcare provider or upload it to your medical portal as well. So the pink dot shows your current risk based on your answers. Notice where that pink dot is in relation to the black line, which is the expected risk. Just below the graph, you'll see the 10-year risk of any fracture and the 10-year risk of a hip fracture. You'll also see the average risk for someone like you. The risk for this person is consistent with their race, gender, and age. As this person gets older, the risk increases. Additional risk factors such as long-term use of steroids, a previous fracture, certain medicines, etc., will put this person above the fracture risk curve for someone like them. The scales on both sides of the graph provide another way of looking at your risk. On the left, you have a percent risk, such as 11% 10-year risk. On the right, you have your odds from 1 in 10 to 1 in 3. Once you determine your risk level, you can refer to this 3-in-1 risk level handout, and the handout is pictured on the slide to help you guide in the recommended next best steps. So let me walk you through the prevention strategies for everyone. Your daily calcium from food and supplements should equal about 1,000 to 1,300 milligrams, depending on your age. On days that you eat 2 to 3 servings of dairy or calcium-rich foods, you may be getting all the calcium you need. On days that you don't eat 2 servings of calcium-rich food, you may need a supplement. If you do not eat dairy foods, you need to find other calcium-rich foods or take a calcium supplement. Now, the body can only absorb 500 to 600 milligrams of calcium at a time, whether it's in food or supplements. And vitamin D is needed for calcium to be absorbed. Few foods provide vitamin D. Although sun exposure is a source, it is not reliable, especially for those of us living in the north who are older or who are concerned maybe with skin cancer and use sunscreen. Take a vitamin D supplement to get 25 to 50 micrograms or 1,000 to 2,000 international units or IUs per day. You also really want to quit smoking. Smoking increases fracture risk. You should limit alcohol. Having 3 or more drinks a day affects your vitamin D levels, your nutrition, and your fall risk. Make your home safe. You can add grab bars and night lights, remove loose rugs, be aware of pets and other trip hazards, use handrails, and watch where you put your feet, and don't multitask. Over the few slides, we'll look at prevention strategies for different risk levels. And remember, if your health changes, your risk results may change too. In addition to the general strategies that everyone should practice, here are other things you should know if you're at low risk. We recommend a bone density test for those people who are 65 and over and have never had one, even if you are in the low risk category. But if you are under 65 and are in the low risk category, please discuss with your healthcare provider to decide if a baseline bone density test would be beneficial for you as an individual. This is especially important if you have any of those risk factors. Exercise and practice body mechanics. Think about whether forward flexion, which is rounding your back, extreme twisting, and extreme side bending is safe for you. Do posture and balance exercises daily, and perform weight-bearing and muscle strengthening exercises to load the skeleton, which prevents bone loss. And then medicines. If you are at low risk and you are on osteoporosis medicine, see your healthcare provider to find out why. If you are in the moderate risk category, get a bone density test if you have not had one in the last 2 years. If your T-score result is lower than negative 1.0, consider seeing an osteoporosis specialist. A couple of examples are rheumatologists and endocrinologists. Your healthcare provider may recommend a medicine. Your preferences, how healthy you are, and your risk of falling will be important to discuss with a healthcare provider as you make a decision about medicine. If you have been on an osteoporosis medicine for more than 3 years, you may want to speak with an osteoporosis specialist. If you are taking a medicine for serious chronic conditions, speak with your healthcare provider to see if they cause bone loss or increased fall risk. And exercise and practice of body mechanics. Weight-bearing activities such as weightlifting and muscle strengthening loads the skeleton and prevents bone loss. But modify your exercise, strength training, yoga, Pilates, etc., in order to protect your bones. Ask your healthcare provider for a referral to a physical therapist or exercise specialist who is trained in osteoporosis and can design an exercise program that takes into account low bone density and osteoporosis. And just like the low risk category, you'll want to avoid forward flexion, which is rounding of the back, extreme twisting, and extreme side bending. It is helpful to do posture and balance exercises daily. And then people who are at high fracture risk need to do everything from the first two risk categories in addition to these. Get a bone density test if you have not had one in 2 years. Think about osteoporosis medicines. Your healthcare provider may want to start you on a bone medicine treatment to reduce your chance of having a fracture. If you are not on osteoporosis medicine, speak with your healthcare provider to see if you would benefit from a medicine. Other medicines or causes of bone loss could be a concern, so talk with your healthcare provider about what might be causing the high risk results. Also discuss how your other medical conditions or medicines may increase your risk of falling. And regarding strength and balance training, it's very important because these exercises can help prevent falls. So work again with an exercise specialist or physical therapist who specializes in osteoporosis to develop a program to improve upper body and lower body strength and balance safely. Now that we've looked at the next steps, let's dig a little deeper about what else you can do. At the beginning of the session, I mentioned that American Bone Health believes that every person should have a bone health plan. So let's look more closely at what that means. The components of a personalized bone health plan will depend on the particular risk category, whether it's low, moderate, or high. Understanding your personal risk factors, talking to your healthcare provider, being active, eating well by getting a variety of bone healthy nutrition, preventing falls by taking steps to improve your balance, strength, and adjusting your living environment, and taking medicine if your healthcare provider determines it is needed. So you can get some additional questions answered by going to the American Bone Health or the Bone Health and Osteoporosis Foundation and linking on to their information or contact site. They would be glad to answer any additional questions that you might have about your personal risk factors and are there to provide several resources and supports to help you on this bone health journey. So I thank you again for your time and look forward to assisting or connecting in the future.